Decontamination and disinfection of OT. Decontamination. According to OSHA, Occupational Safety and Health Association, the use of physical or chemical means to remove any inactive active weight or to destroy any bloodborne pathogens on the surface or item to the point where these pathogens are no longer capable of transmitting infectious particles to someone else. And now this after this process, they are rendered safe for handling, use, and disposal. This is the definition of decontamination. So you make sure that the bloodborne pathogens or any inactivate item present in an equipment or an instrument or any object is no longer transmitting infectious disease, no longer capable of transmitting infectious disease. So once an instrument or other items have been decontaminated, they can safely be further processed, either cleaning, sterilization, or high level disinfection. So even before cleaning, the decontamination is the first most step. Okay. So decontamination, cleaning, sterilization, or high level disinfection, and then use or storage. Or then if you want to dispose something, dispose it into a medical waste category, it can be done. So first decontamination, then cleaning, sterilization, and high level disinfection. So tips for decontamination. Use a plastic container for decontamination to prevent dulling or rusting of any instruments. Do not soak the metal instruments that are electroplated. Chlorine containing disinfectants should not be mixed with acidic cleaning solution because chlorine gas may be released, and this will lead to the safety hazard for the handlers. Leave the room or area immediately when exposed to chlorine gas or ammonium chloride. This has to be kept in mind. These are the tips for decontamination. So to prevent dulling and rusting of the equipments, avoid metal container, always use plastic containers. To prepare the disinfectant cleaning solution, how you would prepare it. Okay, for example, you are making a 0.5% chlorine solution. So you have to add enough in 1 liter of water bottle, 1.5 liter of water bottle, add less than a tablespoon of chloride. Okay, so you can make 0.5% of chlorine solution. If the chlorine solution is more than 1 day old, it has to be thrown away. Chlorine solution should be made on a daily basis. It cannot be made and stored. So for this a disinfectant solution which contains both a disinfectant and a detergent soap, to prepare first 0.5% chlorine solution from chlorine compounds and add enough detergent to the 0.5% chlorine solution. Okay, other than acidic detergents. If any solution that is acidic, avoid that. After decontamination, the instrument should be rinsed immediately with cool water. For example, 2 buckets should be ready. 1 bucket will have 0.5% chlorine water. For 10 minutes, the instrument will be dipped in 0.5% chlorine water. Then in the second bucket, that is the bucket filled with water, it will be rinsed. And then it will be sent for manual cleaning, disinfection, or sterilization as and when required. Okay. So WHO recommends 0.5% chlorine for decontamination. So this table, which is there in page number 109, you can see how different percentage of chlorine is made available. Liquid bleach, it has 3.5% of chlorine, and how to make it: 1 part of bleach in 6 part of water. Okay, how to dilute it? It will 0.5% to 1%. Okay, different diluting percentages are given. Okay, liquid bleach, sodium hypochlorite liquid 5%. Okay, sodium dichloroacetic powder. Okay, 60% chlorine. So this table will help you to understand if you want to dilute in different concentrations of chlorine solution, how you can prepare it for different uses. Preparing household bleach, or if at all there is a large blood spill, 1:10 is the dilution. So 1 part of bleach in 10 parts of water. Okay, and for 20 minutes it has to be kept in contact with each other. If it is just for surface cleaning, 1 part of bleach in 49 parts of water, that is 1:50 dilution, and contact time should be 10 minutes. Minor blood spill is there, 1 part of bleach in 99 parts of water, 1:100 is the dilution, again for 10 minutes is the contact time. This is how you prepare household bleach for different purposes: large blood spill, surface cleaning, minor blood spill. Disinfection of OT, fumigation using formaldehyde. It is no longer recommended in OTs and wards. Although fumigation can be done in high-risk areas like ICU, PICU, NICU, labor rooms, etc., using 2% bacillocid solution, which is 100 ml of bacillocid in 5 liters of water. So this, after doing this fumigation, room must be kept closed for 6 hours. And surface cleaning of wards may be done with 2% bacillocide. Post that, closing is not required if you are just doing the surface cleaning. Fogging has been widely accepted as an alternate method for OTs, where fumigation cannot be done. Fogging is less labor intensive and it is quicker. Okay, you don't have to wait for hours long for it to work, because OTs, you have to, it has to be readily available for every emergency cases possible. Also, fogging possesses minimum health hazard to the healthcare professional as compared to the fumigation, and microbiological sampling and surveillance of the OT is recommended to prevent any healthcare associated infection. So before fogging and after fogging, a microbiological sampling can be done to see if the fogging was adequate enough or not. Spaulding classification. So spaulding, it is a method in which it will determine the instruments and it will classify the various instrument based on how critical it is and what kind of reprocessing it should undergo to be used safely for the patients. Okay, it will just classify the instrument based on its use, based on the patient contact. It will classify, should it be disinfected or should it be sterilized, or just cleaning is enough. Okay, so that is the Spaulding classification. So if the patient contact of the instrument is on the intact skin, okay, for example, when you are checking the heartbeat using a stethoscope and you're checking the BP, okay, you are not placing these on wounded skin or anything. The skin is intact, there is no lesion, no wounds. Okay, so such devices are non-critical. Low level or intermediate level disinfection is enough to be used on the next patient. If you are using instruments that are going to touch the mucous membrane or non-intact skin, okay, for example, laryngoscope, sigmoidoscope, colonoscope, and endoscopes, okay. So these are semi-critical instruments. These are classified as semi-critical, and this will require at least high-level disinfection, if not sterilization. If the instruments are heat sensitive, can't withstand high heat, okay, it should at least undergo high-level disinfection. Okay, so that is semi-critical classification of instruments. Now, the instruments that are critical, which means it will come in contact with the sterile areas of the body, including blood. Okay, such instruments are classified as critical, and compulsorily it has to undergo sterilization before next use. So that's the Spaulding classification. So again, the level of reprocessing required. If the Spaulding classification is critical, okay, it is entry into a sterile area, tissue cavity, bloodstream, etc. Risk is high level of transmission risk is high. It should undergo sterilization, either steam under pressure, automated low temperature, chemical sterilization, or liquid sterilization, or ethylene oxide, whatever is available. Okay. Semi-critical classification, Spaulding classification, contact with intact, non-intact sterile mucosa or non-intact skin. Risk is medium, but still risk is there. So at least disinfection should be done. Heat tolerant items, you can steam sterilize it. But if unable to do steam sterilization, at least thermal disinfection has to be done. And heat sensitive items, low temperature, automated chemical sterilization can be done, or chemical disinfection, high level disinfection could be done. For example, respiratory therapy instrument, gastroscopy, etc. And intact skin, no contact with the patient, it is no critical, low risk is very low to transmit any disorders. Okay, so clean after the use with detergent or water, or at least with 70% alcohol, rub it. Okay, so for example, beds, sinks, etc. And factors associated with pre-processing. First thing is staff training. So the staff working in the sterilization service department, CSSD, are responsible for the repost processing of instruments and equipments, and they should undergo at least formal training in that area. So level of training will depend upon the appropriate level of responsibility each staff has, and appropriate level of processing. The correct level of processing of the equipment or instrument should be followed under the Spaulding classification. Okay. Servicing the instrument and equipments. For example, before sending the medical devices to service or repair, they should be reprocessed appropriately. They should be sterilized and disinfected appropriately before you send the instruments for repair. And even after they come from repair, it has to be sterilized and disinfected properly, and then should be used for patient care. And select the items that you require reprocessing, special reprocessing. For example, endoscopes, respiratory and anesthetic apparatus, vagera, and diagnostic ultrasonic these are heat sensitive. Okay, they cannot undergo steam sterilization, so they require some special reprocessing. They are very delicate measures should be taken to reprocess them. Okay, so these things should be kept in mind. What type of instrument you're handling, do they require any special care while reprocessing, etc. Efficient storage of equipment should be done. Ensure that the product maintains a high level of sterilization and disinfection. Do not store it near any wet place or moist area, or it should be stored in very clean, dry area, protected from any outside damage. So that storage guideline should be followed. All patient care equipment should be considered. Every patient care equipment which comes in contact with the patient should be considered under the Spaulding classification, and accordingly it should be reprocessed. For example, cupboards, chairs, blood pressure cuffs, etc., bed pans, etc. Okay,